Hello, good afternoon everybody. So welcome to Breakout 2 of the UK Cystic Fibrosis Conference. It's a real pleasure to have you here. I hope you're enjoying the conference so far. My name's Belinda and I work for Cystic Fibrosis Trust in the research team, and it's my pleasure to introduce Sherie Smith and Nicky Rowbotham from the University of Nottingham, who will be leading this session. So the session is about the Jones-Lind Alliance CF Priority Refresh, and as you heard a little bit about from Alan this morning, this is an ongoing project. It's a partnership between the University of Nottingham, the Cystic Fibrosis Trust and the Jones-Lind Alliance team within the National Institute of Health and Care Excellence, Care Research. I knew that one would trip me up. So without further ado, I'd like to invite Nicky and Sherie to give you an update on the results that they've got so far, and then we have plenty of time for discussion after they've given their presentation. Thank you.
Thank you, and thank you to everyone for coming into this slightly cold room to listen to us. And there will be a little bit of overlap with what Alan spoke about earlier, but hopefully not too much. Okay, and please feel free, we're a small group, so if you've got any questions, please interrupt us rather than wait at the end. We're quite happy to have it more as an open discussion.
If you do want to ask a question, put your hand up.
Okay.
And I'll bring the microphone to you.
And if anyone is on Twitter and wants to follow our Twitter handle at QuestionCF, then there's ongoing information about the project will be released that way as well in the future. Okay, so just to sort of step back a minute, we think it's often quite good to have a think about the chain of evidence in clinical medicine and why certain things are important. So we need research priorities to be able to develop them into testable hypothesis and then conduct clinical trials or other types of research that may be appropriate for the hypothesis, publish them in an open and honest way, combine results in systematic reviews, which then feed into guidelines, and that helps us as clinicians to make decisions at the bedside or in clinic about what the most appropriate treatment is for the patient in front of us. So how do we decide on the research priorities? Traditionally, it was pharmaceutical industry researchers, funders who decided what the priorities are, with little thought to what actually the patients wanted and people who are working directly with the people in a certain disease area. So as everybody who's applied for any funding recently will know, patient and public involvement is really important and is normally a mandatory bit that you have to fill in on a question on the forms. So why are they important? Well, with limited funds available for research and a limited population, because CF is a rare disease, we don't have millions of people with the condition to do the trials on. It's really important that the priorities that are chosen to take forward are those that are important to the whole CF community. So back in 2016 to 2017, we undertook the first priority setting partnership in CF, and this is following Jones-Lind Alliance methodology, which is a gold standard in priority setting. And this was our mission statement. So we wanted to identify the treatment uncertainties which are important and work together to jointly decide which are the most important to produce a priority list of research questions. So this was the timeline for the first one. As you can see, we started in March 2016 and the process took just under a year to reach our final top 10. This is the methodology that we use, which Alan did cover slightly. So through surveys, we collected questions, we checked to see if they were answered, and then combined similar ones, released them into a second survey and asked people to pick their personal top 10s to shorten the list, and then we took the overall top 20 to a workshop where there was lots of discussion over the course of a day and a jointly agreed top 10 were released. And this slide here just shows you the number of people that were involved at each stage, as Alan has already gone through. So we had over 1,000 questions submitted. We had about a 50-50 split between lay people and healthcare professionals, and these were then taken forward, as I said earlier. So the final top 10 were there, and you saw those earlier as well, didn't you? And hopefully people are familiar with them and have seen research in the different areas in the past 5 years. So on to 2020, as previously mentioned, a lot's changed in CF in the last 5 years with the introduction of modulators and also with the changes that the pandemic's brought. And so we felt it was important to see if the previous top 10 was still important. So this is our timeline for the current project. So back in autumn, we had our initial management group meetings and steering group meetings. As we alluded to earlier in the question that was asked in the first session, the steering group is made up of lots of people from all over the world. We've got international collaborations with other people from other charities around the world, and also clinicians, and we've had MDT involvement as well in the process. So and lots of patient representation as well. We had our initial survey back in January, February time, and at the minute we're in the process of checking the uncertainties and pooling them together in umbrella questions. I think one of the things, this is the first time anyone's done a refresh of priority setting partnerships. As Alan said before, there's been over 100 in different disease areas, and we're one of the first areas to refresh. So we're kind of making up the methodology in a way as we go along. So it's a really interesting process, and we're learning and adapting, and the traditional methodology of the JLA priority setting partnership, actually I think research has evolved slightly, and not everything needs to be answered through clinical trials. So we're coming up with it's an adaptive process, isn't it? And yes, we're trying to make sure that we are taking forward questions and making sure we do the justice to everything that's been asked. And we had a lot more responses than we initially thought we would. We thought we'd be lucky to get 50 new questions suggested. And as you can see, we had over 1,600 total responses. Some of these were empty, and some of them were from the same individual. So that gave us a number of 1,370 individual respondents. We released a survey in several different languages, and so you can see those different, and the languages were chosen by the resources we had available, so people who had volunteered to put them into to translate, and I think that helped with our larger response from our European colleagues and people with CF and their family and friends, because actually it's a lot more accessible. So that's a change from the first priority setting partnership. So again, a refresh. Alan's already gone through this a bit. As you can see, we've had a lot more responses from the lay community, so people with CF and their loved ones, which I think is representative of. Sorry, I'm losing. It's because I think people with CF are so engaged at the minute in research, and all the recent changes with the modulators. There's a real sort of movement behind getting on board with research, and I'm really pleased to see that.
But the other thing was that we did have a really good response from the kind of professional and the clinical side, but we've just had extra from the sort of lay community. So it kind of looks like, oh, we haven't had such a good response from the professionals, but actually we have. It's just that the lay community have submitted even more. So.
Yeah, so it's really good. So we're quite happy with the number, and you can see the split. As Alan said, the dietitians and physios were very, very vocal with their opinions, and last time we found those groups had really good engagement as well, and the response of people on modulators or not yet eligible, as you've seen already, with the people from all over the world, which was really nice. So these were the initial questions after the demographics. We asked people to go through the previous top 20. So all the ones that were discussed at the very first workshop were shown online, and you could pick which ones you thought were important and then pick your top 3 out of those. So this lets us see which questions from the previous priorities were still priorities today. And then we also asked for new suggestions.
We did.
So pass over to Sherie now.
Lovely. Questions. So as well as asking people to rank their personal choices from the original top 20, we also said, is there something that's not on the list that you think is still is a priority for research? So we asked for new questions. We asked for up to 2 new new suggestions about anything really that's connected with CF and about the treatment that people are receiving to go through to research. So then we had a fantastic response again with this. So some people gave us 2 questions, some people just 1, some none at all. But we ended up with 971 individual questions, and which we sort of compiled in a list underneath each other, and then went about cleaning that data so that we literally end up with a list of questions which they were all assigned a unique ID. So although we can actually track back and find out who asked that question, for this part of the process, we're kind of not interested in that in a way. We just want to know what the actual questions are, because the whole point of this is to try not to introduce any bias. So we're purely looking at the questions that have been submitted. So we've put it all into Access and Excel. And then what we've done, the 2 of us independently have read through every single question. And then obviously if there's areas where we disagree, we can discuss that. But then we've put them into broad categories. So
just to say, when Sherie says we can go back and see who asked the questions, we mean in terms of demographics. We've made sure there's no identifiable information about the actual person.
So the scope of the PSP is, again, perhaps slightly different to the original, because the original was purely about treatment uncertainties and was about research questions that could be answered by a clinical trial. So this time we've said the scope of the refresh is we're looking at treatment options and treatment effects, which will include care and management as well, so social, emotional and psychological well-being of people with CF and the coexisting conditions. We would then exclude anything that's about access to services, so that might, sort of the questions about inequalities between care teams and those sorts of things.
Also from country to country, because it's open globally, and obviously we've got different funding methods in different countries and how and whether people's health is funded through insurance or by the national health system. So we sort of parked all those ones to the side.
So we've got our long list of questions. Those aren't actually the questions, they're something totally different. But and then so we coded them into broad categories, which were either in scope or out of scope. So i.e. the ones that are in scope are the questions about treatments, like we had in our definition. The out of scope questions are things like lifestyle planning and organisation of care. And though what is really important is that none of those questions will be ignored. They're just not going to go through to the actual priority setting process, but they will be dealt with in other ways. So it might not actually be involved in this process, but nothing will be lost. So, all of the questions are important. So once we'd put them into the broad categories, so we ended up with 971 questions, split them into whether they were in scope or out of scope for the PSP. And then the ones that were in scope, we then coded them into smaller categories, sort of represented by different treatment areas. And then for each of the individual categories, we had the long list of underlying questions. So we came up with umbrella questions that would encompass what was underlying. So sometimes we would literally use the text that had been submitted in a question. Other times we were able to tweak the wording slightly because there might have been 2 or 3 questions or more than that were really asking the same thing. So we tried to sort of lump those together. And I mean, this has been slightly iterative as well, really, hasn't it? So once we'd got our umbrella questions with all the underlying data, we then involved the management group and the steering committee to kind of sense check what we'd done. So we were wanting to, have I got a slide for that?
Yes.
Yes. So we've ended up with a list of umbrella questions. So what we wanted to make sure was that those umbrella questions actually represented what people had originally asked, and we hadn't kind of tweaked the wording so that it actually became too broad, or we'd introduced things that perhaps weren't really in the questions but sort of made sense to us. So we've tried to purely represent what people asked. And then, so we've then got our long list of umbrella questions that we've had sense checked, and at that point we need to go through the list. We need to check that they haven't already been answered by research, and we need to check that they make sense, obviously, because this will be going back out to the whole CF community, so we need to make sure the language is understandable to everybody, and also highlight questions that have come in that were actually asked in the original PSP, so we've highlighted those as well. So the result will be, this is kind of still ongoing. We haven't actually got our finished numbers or anything yet, but the idea will be that we'll have 15 questions from the original PSP that people ranked as most important. Then we'll have our list of new questions, so we'll add those on. So we get a nice long list of questions, hopefully not too long, because obviously this is going out to a second survey, and what we want to do is ask people to go through all the questions and swipe across ones that they're interested in, and then once they've picked the ones that they're interested in, we'll then ask them to pick their own top 10 and rank them. We were asking them to rank them? Yeah. So
we're almost there, but as we said, it's, you know, there's a lot, we got a lot more data back, which is brilliant, than we expected. So we've got a lot more questions, and we want to make sure that we're really doing justice to everything that's been asked. So we're spending quite a bit of time to make sure that we do get it right.
Spot on. Yeah. So when we've got our list of umbrella questions, we've sent that out to the second survey, we'll get the results of that back, do some quick analysis, and then we will take, I think, are we going to take?
We're going to wait and see where somewhere between 15 and 20 questions
to go through to the final workshop, because the workshop this time will be slightly different to last time because it's all going to be online, and so the JLA have kind of advised us that you perhaps need to keep numbers smaller than we had done previously.
Because last time we had a hybrid workshop, which is this picture's taken from that. You can see the people with headphones on were the ones that were joining remotely. So it's going to be more level playing field if everyone's all joining in the same way, I think.
Yeah. And hopefully at the end of that day, everybody will have had their chance to have a look at the questions, and jointly we'll come up with a new refreshed top 10. So we're just getting towards the process of actually sending out survey 2. So if you follow our Twitter link, then hopefully you'll spot when that comes out. So it doesn't matter whether you took part in the first survey or not, you can still take part in the second survey. Or if anybody wants to send us their email address, we can add you to we've got a list of people who said that they wouldn't mind being contacted, from the first survey. So we can always, and then we will be emailing everybody to say that survey 2 is out. And then that gives you all your opportunity to pick your own personal top 10. And gone.
And then obviously we need volunteers to take part in our final workshop. The dates are still to be fully confirmed at the minute, but if you'd like to express interest, there's a short form online already. As soon as we have the actual dates, we'll add those to the form, but if anyone wants to register their interest to take part, then we'd be pleased to hear from people, and we want representation from the whole CF community. So and the final workshop will take place over 2 short afternoons, 1 2-hour session, 1 3.5-hour session, I think it is. So that's where we're at. We're sorry we can't share any specific data with you at the minute, but we've all got our own interests and all that, and we don't want to bias the information at any point. And when you're doing the second survey, it's really important that you choose what you want, not necessarily what you think someone else wants, because it's the individual response for that bit. Whereas when it comes to the workshop, we want people to then take on the role of representation and thinking about what everyone might want. So it's sort of two different viewpoints.
Because I think at the workshop, when people get the list of questions, I think they will know how many people were lay and how many were professionals that answered the question. But at this stage, at Survey 2, it's just purely the list of questions. So
it's a bit of a whistle-stop tour. Does anyone have any questions about the methodology? As Sherie said, like, none of the data will be lost. We'll share it, and we'll be working with different partners and things to make sure those questions that don't necessarily fit here but are still important that somebody's spent the time to ask will work. Because I know we've got lots of different plans for things, haven't we?
Thank you very much, Nikki, Sherie. That was really great overview of the whole process. I know they've made it sound very simple, but I know it's considerably more complex than that. Lucy, I wondered if you wanted to say anything a bit more about how the Cystic Fibrosis Trust might manage those out of scope questions.
Thanks, Belinda. And I guess I just want to say a huge thank you to Nikki and Sherie for all the hard work so far. It has been a bit of a slog getting to all that data, and they've done a fantastic job of it. And I know we're not quite there yet, but they've been working tirelessly on it. I know you've had some ridiculously long days trying to sort that out, so thank you. In terms of the questions that are deemed out of scope for this priority refresh, we will be, where we can, feeding those back into the trust. So there will be things around policy, for example, that we might want to consider how we respond to. There could be issues around certain communications that we need to put out to support people with cystic fibrosis. They don't think they've got access to the right information. They need to support them at the moment. So there are some quite interesting and detailed questions that we absolutely will be responding to, and we will make it very clear in the response how we are responding to them. So it will hopefully be a very transparent process, but there are some really interesting questions around finances, etc., which will feed into the cost of living work that we're doing already. So yeah, it's incredibly valuable, both from the research side, but also from the rest of the trust activity and how that informs our strategies going forward.
It's a real privilege to read everyone's responses, and because people have obviously spent time and really thought hard about what they're putting here. So I want to say a massive thank you to everyone who's taken part and given us all this information.
Has anybody got any questions?
I really enjoyed that, and you said earlier about the demographics of people who have submitted questions, and at the moment you're not looking at that, and I was just curious as to whether that would be something that you'll look back at and what you'll do with that information.
So we've looked at it. We've done a brief overview there, so we can see which groups, and as we're going along, we have a look and we use information like which specialties are responding, and then we can poke the people that we know, say of that certain MDT group, saying, could you try and prompt your members or put out some more targeted tweets or emails to try and make sure we're getting fair representation of everybody. What sort of things would you think would be interesting to look back at?
I'm just always fascinated to see if there's like a story emerging in terms of concerns, having a commonality in terms of people from a certain region or profession, that you're getting kind of trends, and is that something that's surprising you in this work?
So last time, after we'd done the PSP, I looked back through all the data to work out a bit more about who'd asked what in a more sort of defined way, and I presented that at the North American conference to have a look to see by country what the themes were, and also so that is something that we could look and see. And the one thing I'm really interested to see is the difference between what's been asked now and who's asked what now to last time. And I already know in my head, we've picked up certain trends. Obviously, we don't want to bias anything with releasing those and changing people's answers for the second survey. But there's some really interesting differences in what's been asked by who compared to this time, so 5 years ago. So that's another thing that we'll hopefully.
I think that's why we included whether people are on modulators or not in our original survey, so that hopefully we will be able to go back and do that kind of analysis and find out, did the people who are on modulators ask different questions to the people who weren't. I guess it'll be about funding, won't it, as to whether we can.
And time. But
funding and time.
we were careful because we obviously wanted knowing the demographics is important, but we wanted to make the survey as easy and quick for people to fill in as possible. So we didn't want to bog people down with too much, because we know from some of the other work we've done, some people are like, why do you want to know this? You know, why do you want to know my age? And just simple things like that. So we were trying to keep it to the minimal but interesting information.
And I guess just to add to that, that the questions and the data that are underpinning all of this research when it's published will be available to researchers as well.
Yeah.
So all the underpinning questions will be published on the JLA website. So it's there for people to interrogate, and we'll obviously have, through the trust, we'll have access to that data as well. So there's a lot more depth that we can go into in terms of the data that's been submitted and who's submitting it and what those trends are telling us.
Absolutely. When it's finished, we're more than happy to share information. It's anonymised and with a good reason, because there's too much for two people to do in a few hours a week. So.
That was handy, wasn't it? Margarita.
Thank you so much. This is really, really very interesting. And thank you for all this work. It also helps us researchers to put things into perspective. So what is really, the pressing questions from the community that is most beneficiary. I actually wonder whether under those other, where are researchers? Are they under the other group?
Are they?
It's a thing.
So in I took the numbers off just to make it easier to just see the actual trends when I was putting these on, because I know Alan had already put them on his slides. So the non-industry researchers are in the bottom, the second green bar on the top graph, and the MDT members that are down on the bottom graph, that number's taken from the healthcare professionals.
I get it.
So actually you can see that of the 26%, 8% of the total numbers were researchers.
Thank you. I also have a suggestion, because I was looking at the questions in the the 2017 survey, and my impression was that most of these questions were like asking for short-term. They were short-term. I think it would be really interesting to sort of subdivide and have short-term priorities, mid-term priorities, long-term priorities, especially because now with the novel modulators, I'm sure that there will be, as the lifespan extends, I think there will be other questions which maybe are not so short-term. For instance, what is the effect on the liver of having these medicines taken for years and years? Or, what's the effect, for instance, of cancer? Because we know there is this cancer propensity. So, of course, you should not wait like 10 years so that these questions come up, because we need to anticipate them. There is this saying, beware of the elephant in the horizon. It will hit us. So maybe it would be interesting, it's a suggestion to have this separation.
Obviously, again, without releasing too much about the data, you may find that the questions that have been asked already may reflect that. This is what I mean about the differences in how the questions have been asked and things, and people may be looking more to the longer term now already.
Absolutely, and I think that, as Nikki mentioned earlier, the scope for this original PSP was very much health uncertainties or treatment uncertainties and impact over 5 years. We've broadened the scope for this, and we've included researchers. So in that first PSP, it was healthcare professionals and people with CF. This time around, we said healthcare professionals, people with CF, and researchers, because we recognise things are changing. There's things that, like you say, are on the horizon we need to be dealing with now, because they're going to be an issue for people with CF in a couple of years, and we need to be thinking about it now. So there's some really exciting questions that are coming up that we can't talk about, but I wish we could.
You'll be able to see them all when you do the survey.
Yeah, and some of those are much longer term. They're not as necessarily easily answerable as these original PSPs. So that's kind of what's making the data analysis quite so tricky. It's understanding how broad our scope is and at what point we have to stop and say, no, that is really out of scope, but it's interesting and therefore we'll pick that up later. So yeah, it's a great point, thank you.
Because that's the thing as well, because we, you know, it's such a privilege, people have given us all this information. We don't want to make anyone feel that their information hasn't been looked at. And so it's, getting the balance between not having too many questions so that when you're faced with the second survey, you get bored and end up switching off. So trying to encompass everybody's questions within the umbrella questions that we're going to put forward without losing anything and making people feel that their question was valid as well. So it's a tricky balance, and we're really working hard to try and get it right for everyone.
Are there any more questions anybody has?
Can I ask a question?
To whom?
Just out of interest, did anyone take part in the first survey here?
You're asking when?
Yes, if people did, yes.
Yeah, I did.
Yeah, so a couple of you. Will everyone take part in our second survey, please? Watch out for it.
Actually, Nikki, I wondered if you could say a bit more about the makeup of the steering group.
The makeup of the steering group. So we've got a small management group, which Alan had everybody's pictures on the slide earlier, which consists of some valuable people from the trust with different skills and backgrounds. Sherie and myself as the data team, and Alan, and then also representatives from the James Lind who are giving us their valuable knowledge and experience in how to help guide us. As we said before, we're the first disease area that are doing a refresh, so it's a lot to learn. And then the steering group, we've got international representation, so we've got people from CF Europe, Canada, the CF Foundation, we've got clinicians, more science research. Help me out. We've tried to, and then we've also within our sense check-in and discussions, we've gone to through the CF Trust. We've had Lorna's helped us with, from a patient engagement point of view, hasn't she, with her young people's group. We've had the MDT representation to help us as well. So it's been brilliant how much help we've had to try and guide the project. Did I miss anyone out there?
Members of the CF community.
Yeah, so we've got, and Zoe obviously, who's done, she's a parent of twins of CF who's done an absolutely fantastic job right from the start with the branding and making sure from the social media point of view from the first project. Then she's been you two guys have been working together, haven't you, try and make sure we get as many people as possible involved.
Okay, so if we have no further questions, then I just want to say thank you very much to Nikki and Sherie. That was a really interesting overview, and thank you very much for coming along to the session. I'm sure if you're a bit too shy to ask questions in the room, then you can ask them individually in our now extended coffee break. So we're going to be back in the main room at 3 o'clock. Thank you very much.